Hi, my name is Julie Peterson. I'm a psychiatric nurse practitioner student at Purdue University Global. So today's journal is about kind of a self-analyzing final video prompt. So it's a reflective journal. So some of the questions that we need to address in this video include goals that we set for ourselves. So the goal that I really set for myself was just to be a little bit more able to speak to the patient, especially in some different circumstances, that are, struggling, you just kind of struggle to find the right words or the right things to say, or, when is a good time to have appropriate silence. So I think I did pretty well with that. I had very few instances where I felt uncomfortable. And I think that if I feel uncomfortable, I think that the patient kind of sees that. Maybe that kind of takes away from their experience that they're having. So I think I did pretty well with that. Of course, always room for improvement, so I'm going to continue to work on that. Feelings of prejudices, biases that I've had during my clinical experience. So it's kind of easy to, when you look at someone, you kind of come across with just a certain opinion of them. But I really just try to take everyone is working in their own little movie, kind of their own little life. It's not as life really isn't as nice and clean as the movies. So I just try to listen to their story and kind of put myself in their place, and maybe you need to paint them 20 years younger, before life got to be so hard. And that kind of helps you kind of see them in a different light than maybe what they might be presenting to you at the time. So, and anxiety and self-doubt and uncertainty, how do I manage that? I usually just try to, be as confident, take a deep breath when I can, just talk a little slower, um, give the patient a chance to speak up and not try to, try not to monopolize the entire conversation. So insights and understandings that I gained during the clinical experience were probably mostly about the magnitude of some of the patients that, their suffering that they have. I know everyone struggles with their own little demons, but it does seem that some patients really just have a lot of issues going on. A lot of them are not their fault, or they got into the situation and they can't get out of it. So it just kind of winds up being this ongoing, drama of their lives that they just have a difficult with. So, I really kind of find that very sad, that, people can't be born into a life where they have a certain expectations, food, housing, and, clothes on their back. But I guess that's just kind of the way things are. Perhaps maybe one day it'll change. And then how has it impacted me as a student, a person, and a provider? Just kind of gives you, I think, a lot more empathy when you see, patients like that, that you see how, just what bad circumstances that they can come from. And then sometimes they just have very bad things that just happen to them. So, kind of, let you down a little bit as to humanity. Um, they're not very good to each other most of the time. And then in my future practice, I hope to just continue to work and grow in my skills, my therapeutic teaching, and learn and read more, and continue to just work, as best as I can. And I hope to get, have good clinical experiences and good practices, nurse practitioners that I can work with, and, therapists. So I can see some of the ways that they do stuff and kind of be inspired to do that. And I think that is it. If you have any questions or comments or concerns, please just give me a call. Thank you. Bye-bye.